Good morning, everyone. How's everybody doing this morning? I just want to let everyone know that you are muted just because we do have a large number of participants and I don't want to interrupt our three presenters. My name is John Looney. I'm the program director for the Human Service Division here in Luzerne County, and I will be your host for today's meeting. And I'd like to welcome you to our 2020 Caring Community Expo, virtual expo that's being hosted by our Luzerne and Wyoming County System of Care. Today's presentation, Saving Lives, will be presented by Leslie Washington and Melissa Michael from Community Care Behavioral Health and Donna Ravinsky from Scranton Counseling Center. I would ask at this time if Leslie, Donna, and Melissa would unmute themselves, and I would ask that all others remain muted again, so not as to interrupt our presenters. A reminder for everyone that this meeting is being recorded, and a copy of today's recording will be shared on our System of Care website for individuals who wanted to participate in the training but weren't able to make it at this time. I would also like to inform folks that in the chat box, there is a SurveyMonkey link, and when you complete that SurveyMonkey, you will get a certificate of participation for today's training. And even if you're not interested in a certificate of participation, we ask that you do please complete that survey just so we have an idea of how we did selecting our presenters. So with nothing further, I'm going to turn it over to our three presenters, and thank you again for participating.
Thank you. So we are excited to share with you the success of the Behavioral Health Home. And the reason we call it success is because it really does save lives. So let's look at the agenda. So the agenda. There you go. Okay. So our goal is to understand what a behavioral health home is and the principles and the interventions for the youth and adults, and why those interventions are so critical. And then we'll talk a little bit about the virtual team that really makes this happen. And then we're going to give a few examples of the success stories, and then we can have questions and answers. Okay, so let's look at the program. Okay, so Community Care applied and was awarded a grant from the Patient Centered Outcomes Research Institute. You may have heard of that, as better known as PCORI. And PCORI supports research that aims to provide information about the best available evidence and interventions so that providers can make more informed decisions about their care. And the goal is to support studies that focus on outcomes that matter in real settings. In this case, it's the community mental health centers, the RTFs, the school-based program, and even the opiate treatment facilities. Now, this study was partnered with 11 providers, and now we have over 60 providers throughout Pennsylvania. So let's look at why adults. So here's the criteria for the adult behavioral health home. And adults living with serious mental illness frequently have unmet medical needs, which place them at high risk. You may have heard the statistic before. As a group, individuals with serious mental illnesses die as much as 15 to 25 years younger than the general population and are at high risk for cardiovascular disease, diabetes, and obesity. The Behavioral Health Home delivers holistic care, and it focuses not only on the mental health conditions, but also the physical health. The wellness coaching delivered in these behavioral health settings focuses on modifiable risk factors such as body weight, physical inactivity, tobacco use, and attention to preventive care and follow-up care for chronic illnesses, which are the pillars of the integrated behavioral health services. So what you have is a behavioral health system assessing and supporting the person to manage and monitor their whole body. therefore creating opportunities for a longer lifespan. And participating in preventive care is really one of the major components. So let's look at the adolescents. Here's the criteria for the adolescent. Now, you would think that adolescents do not need this type of attention and that they get the required preventive care that is mandated for their age. But research has shown and indicated that the majority of adolescents' medical visits are for acute care, and only 1 in 15 visits is for preventive care. The behavioral health home is a great opportunity for the behavioral health care providers to guide youth who have been diagnosed with serious emotional disturbances and identified with high BMIs. And BMI is body mass index. So as with any age group, overall health and wellness is important, but perhaps even more so at this age. The behavioral health home helps adolescents establish good health habits that can reasonably be expected to carry over into adulthood. Good physical health contributes to good mental health, and similarly, the presence of physical health disorders can negatively influence mental health. For example, obesity. Obesity is now the #1 health concern among parents in the United States, topping drug abuse and smoking. Today, about 1 in 3 American children and adolescents is overweight or obese. Among adolescents today, obesity is causing a broad range of health problems previously not seen in adulthood. So these include high blood pressure, type 2 diabetes, and elevated blood cholesterol levels. And you usually don't see these in adolescents. And there are also psychological effects. Obese adolescents are more prone to low self-esteem, negative body image, and depression. Excessive weight is associated with earlier risks of obesity-related diseases and death in adulthood. Perhaps one of the most sobering statements regarding the severity of obesity epidemic came from a former Surgeon General, Richard Carmona, who characterized the threat as follows. He says, because of the increasing rates of obesity, unhealthy eating habits, and physical inactivity, we may see the first generation that will be less healthy and have a shorter life expectancy than their parents. So, what is the behavioral health anchored on? Let's look at that. So the behavioral health home is anchored in wellness. And many of you may have heard of Peggy Swarbrick, a person with lived experience, Dr. Peggy Swarbrick, may I add. And she talks about wellness like this. Wellness is not the absence of disease, illness, and stress, but the presence of purpose in life, active involvement in satisfying work and play, joyful relationships, a healthy body, and living environment, presence of happiness. So basically, in a nutshell, what she is saying is that you can have a physical and or a behavioral diagnosis, but it doesn't mean that you cannot live a happy, satisfying, and joyful life. Next. So what makes up this behavioral health home? Like, how does it operate? Well, it's a team effort, and it's a big team effort. And even before we came to COVID-19, the behavioral health home was working virtually. And when I say that, meaning that all the partners and team players are not in the same place. It's, and so part of the model is to create a strong system of support and what we always have called the virtual team. And what this is the behavioral health system resources, the physical health resources, and the community's resources, all working together, being proactive and attentive to help keep people healthy as possible. And Melissa will be speaking more about this in detail. The last me. So earlier I did talk a little bit about the PCORI project which started this whole of the behavioral health home, and it was under research, 2 years ago, and we have been very successful with this, and you can see the success that we have made. We have achieved positive health and wellness goals and increased the patient activation, along with increasing primary and specialty visits. 40% people are now attending their PC visits annually. So it hasn't stopped with the PCORI project, and Donna and Melissa is going to talk to you more, and you'll hear how it continues in our 60 provider sites. Melissa.
Thank you very much, Leslie. Good morning, everyone. If we can go to the What is BHHP slide. So just as Leslie had just eloquently described, Behavioral Health Home Plus, also known as the acronym BHHP, is an intervention developed by Community Care with stakeholder input. An intervention is key. It enhances the capacity of behavioral health providers to serve as health homes, supporting that holistic care, breaking down the barriers between physical health and mental health so that everyone on both the behavioral health side and the physical health side are communicating with each other and breaking down those silos so it's true holistic care. Anyone receiving mental health services where BHHP is being implemented is eligible for Behavioral Health Home Plus services. So I want to draw your attention over to the diagram on the right, where we have this, as Leslie said, this virtual Behavioral Health Home Plus. We broke it down, though, as you can see, we have the foundation and then a lot of moving bricks and floors of this virtual health home. The foundation of the Behavioral Health Home Plus model is key, which is the plus piece in BHHP, is the wellness nurse, the wellness coaches, also known as health navigators. That's what makes our model unique, is that we implement wellness coaching as the intervention in this health home. And as Leslie had mentioned, there's many, for the first floor, we have the PCP and medical resources, many community resources and supports, the psychiatrist and the behavioral health services. They all are communicating with each other and moving parts of this health home. And then also, if you notice, as I always say, the top floor here of the health home, we have community care behavioral health organizations' role in supporting the overall BHHP by offering self-management tools, be it toolkits, ongoing learning collaborative trainings, ongoing learning association meetings, such as our monthly wellness nurse support calls, our case consultation calls that are held monthly, ongoing collaboration with the Behavioral Health Home Plus team, and of course, our ongoing wellness coaching training. Next slide, please. So who are the team members of the Behavioral Health Home Plus model? We wouldn't have a team without the individual in care and their family and their supports. We also have the wellness nurse, the health navigator, also known as the wellness coach, the primary care provider and medical specialty offices, the psychiatrist and the mental health clinicians, the behavioral health treatment team, and then we also have community care specialized care managers. Next slide. So the individual and family or supports role. They choose an area for self-management, primarily in the Behavioral Health Home Plus model right now. We have many areas, 8 domains of wellness, which I'm sure you all have heard about. We like to target, for the reasons that Leslie had mentioned earlier, the physical health domain. So generally, they choose an area for self-management and working on wellness in the physical health domain. They develop new self-management strategies with the support of the Behavioral Health Home Plus team. They set a SMART goal and create an action plan. And it's key to remember that this isn't an assigned goal that a therapist or clinician may write up for an individual, but there's a intense process that is based on the wellness coaching principles of Dr. Swarbrick and their team. There's a tool that the wellness coach and the individual work on to complete a goal that is very self-directed, and it's also very strength-based, and it's a goal that the individual wants to work on and chooses for themselves. Then the individual implements the plan with intention of meeting the goal. They monitor how the plan is working. So if they choose that they want to drink some more water, but then they've accomplished that goal, and then they want to work on maybe exercising a bit more, or if they even choose a goal that they're not really satisfied with, they can monitor that and adjust that goal as many times as they want so that it's a custom fit to their needs. And of course, they adjust the plan as needed. Next slide. So the wellness nurse. We do have Donna Ravinsky on the call, who is one of our expert wellness nurses from Scranton Counseling Center, which is one of our Northeast providers. So I'm not going to go into too many details about the role of the wellness nurse because you'll hear it firsthand from Donna. But I can say the wellness nurse provides clinical consultation with the physical health and behavioral health clinicians and the individual and their supports. They generally identify the high-risk individuals in care. They assure a completion of a wellness physical assessment so that no one falls through the cracks, so that although the behavioral health team is talking with the physical health team, when they have that one-to-one with the wellness nurse and complete this physical assessment, they make sure that there's no gaps in care. They utilize a wellness registry to monitor progress for each individual participating. And a key step too is they coordinate and collaborate with the primary care physician and specialty medical providers. Again, breaking down those barriers to communication with the behavioral health team and the primary care medical team. They supervise the wellness coach process and implemented by the wellness coaches and health navigators. And they provide ongoing wellness education for individuals in care, the family, and then also the wellness coaching staff. Next slide. So the health navigator, also known as our wellness coaches, they provide enhanced behavioral health services. And this enhanced service is based on the model of wellness coaching. They support accessing and coordinating both the physical and behavioral health services for individuals in care, the wellness coach or health navigator for the individual to support his or her own advocacy within the healthcare system. They apply wellness principles and coaching techniques, and they assist the individuals to identify strengths to achieve wellness goals, and they always encourage family and/or caregiver participation. Next slide. Both the wellness nurse and the wellness coach model wellness and recovery. They advocate for unmet needs. They accompany individuals to community appointments if asked. They provide peer support change through stages of change, and they create environments that promote wellness and recovery practices. Next slide. So the primary medical provider or the medical specialist, again, as Leslie mentioned, is that virtual team member. They provide the physical health clinical services, but they also have access to the behavioral health team services and supports. And there's ongoing reciprocal communications with all the BHHP team members. And I can speak that, which Donna will mention too, about the role of the wellness nurse, but there's so many times that we have heard through our case consultation calls and our wellness nurse support calls that both the primary care physician and the behavioral health provider or the psychiatrist are so thankful that they have a person in the office that they can have as the primary contact so that they can share information and work on that same treatment plan. Next slide. So the psychiatrist and the behavioral health team, they provide the mental health clinical services. They have access to the physical health team services and supports. And again, there's that ongoing true reciprocal communication with all BHHP team members. So it's not only record sharing or sharing lab work or sharing goals, but it's that true doc to doc and a lot of times nurse to nurse communication with the PCP or medical specialists, again, so everyone is treating that individual with true holistic care and breaking down those barriers. Next slide. So I wanted to mention again how Community Care supports the Behavioral Health Home Plus team by providing ongoing training and support in our calls, but we also have virtual high-risk care managers from Community Care. Our care managers assist Behavioral Health Home Plus regarding individual strengths, their care history, and their treatment plans. And on today's call, we do have Sarah Zagalia, who is one of our Music Office Northeast high-risk care managers, who's been actively involved in supporting all of our Northeast providers in obtaining, again, additional information that can support the individual in care with their not only their behavioral health treatment, but also their physical health treatment through the Behavioral Health Home Plus team. Next slide. So again, I want to thank you for your time, and I now will turn it over to our wellness nurse expert, Donna Ravinsky from Scranton Counseling Services.
Hi, thanks, Melissa. Well, I want to thank everybody for your attendance here. So yes, my name is Donna. My role on the team is the wellness nurse. I'm just one of those pieces that make up this BHH team. So now that you see what BHH is, the why we're doing this work, and who we are focusing on, I'd like to present, how we work with the individuals. So I'd like to start off by saying, each individual we work with is unique. Once we start working with these individuals, we see such positive improvements in their health. You will see that because the individual wellness goals are endless. So in a few minutes, I'll go over several examples of individuals and their goals that they've had. But first, I'm going to just go over this list of benefits that these folks are going to be gaining by participating in this BHH service. So the first bullet point there is that folks are going to have a greater engagement in their primary care and specialty care. This will happen by the nurse and the health navigators. We can accompany them to their individual appointments and just be there as an extra set in ears, but also guide them. Maybe like, these are questions you should be asking the doctor, just giving them some guidance. The wellness nurse is able to collaborate again here. This is an opportunity that she can do that with the doctors, making sure all doctors are on the same page. So folks will definitely see an improvement with, their appointments. The next bullet point is the assessment of the undiagnosed or undertreated physical issues. Well, folks have difficulty expressing their symptoms. This is something I've seen, like they have a hard time, expressing exactly what's wrong. Makes for hard for doctors to actually diagnose them. But then also sometimes doctors have a difficulty time diagnosing them, just sometimes if they're aware of maybe their mental health illnesses, and sometimes things do get overlooked, unfortunately. But we're there to guide them. So we're able to just, be there, ask questions, and just guide them through their appointment. Hopefully, by them feeling comfortable with us, we're able to get the information they need across to their doctors. The next bullet point is increased awareness of nutrition, diet, and their body mass index. So nutrition is a really broad topic. There's so much to talk about. Each individual, again, is going to be different, but we like to find out from them specific information. So we'll have discussions on what food choices they're making. You know, are they folks that like to cook? Or do they buy frozen meals, processed meals? Do they do their own food shopping? Do they make a grocery list when they go shopping? And do they understand the nutrition label and how to read it and read the ingredients? There's so much to learn. This is such a great benefit, this nutrition piece, talking to folks about it and educating them in it. So they definitely walk away with some benefits there. The next bullet point I have is increased physical activity. We're going to be encouraging folks to be active, finding what it is they like to do to be active. We'll talk about the benefits of exercise. Obviously, it's going to help your physical health in various ways, but it's also going to help out your mental health. Of course, that helps in several ways too. It's going to boost your mood, it helps you sleep better. So some folks don't realize that. Let's see, the next bullet point is the medication management. So folks, we like obviously to educate them on their medications, making sure they know what they're for. So many times I've, come across people and we'll talk about, I'll say, well, what are your medications? And they'll say, I don't know. So, we're gonna educate them, even if they're getting them in a pill box and they aren't, sure which medication is which. Well, nowadays, right, it's so easy to get a printout, get pictures. They'll know what medication is which inside that pill box. Talk about how to store your medications and most importantly, like how to remember to take them. So, finding what works for them. So they're going to benefit from that. The last bullet point there is development of stress and management relaxation techniques. This topic has been huge during the pandemic. We have discussions on ways to relax, reduce stress, get them linked up in the community to different events that can be going on. And a big one nowadays is just YouTube, just so you're safe, right? We're not around others. So using YouTube if they're suave with their phones, they can go to meditation sites. Something we like to do is encourage folks to relax, finding out if they like to color, do word finds. We'll print those off for them. Coloring sheets, you can get them to print off word finds, word puzzles. So they're going to benefit from that. And then the next slide, I have some more wellness benefits that the individual is going to gain from in behavioral health home. So they're going to have an increased participant responsibility and participation for their own emotional, physical wellness.
Donna?
So, yes.
Can I interrupt you? I'm sorry. We had some technical difficulty with the slide. I'm going to pull it right back up, but you could continue speaking and I'll make sure we get it right up.
Okay. Thank you, John. So the first bullet point, the increased participant responsibility and participation for their own emotional, physical wellness. So with our team's consistency in wellness discussions, we see individuals become more aware of their own health. It leads them to be more involved at the doctor's appointments. Over time, they seem to get a little more comfortable discussing their own health. Some folks have a really hard time doing that. And it could stem from just the way they were brought up. But educating them in this and guiding them is extremely important. And again, I know Melissa had mentioned, like, this is a time too, will the behavioral health side appointments and the physical health appointments could collaborate. Our psychiatrists will be very open to discussing their behavioral health goals. If I'm attending their appointment with them, it's something we bring up, we talk about. So it's nice to see everybody on the same page. The next bullet point, reduction of need for emergency care. Becoming more involved with the doctor and how to navigate within the health system. And I think that once they become, more involved with some of these other bullet points that I've mentioned, like they're getting more involved with their doctor appointment. We're guiding them with some of that, and they're understanding the health system. And really, it does lead to them avoiding the emergency room and sitting countless hours in the waiting area to get seen. We all know that, once you go to the ER, they're going to suggest you follow up with your family doctor anyway. The ER is just going to treat your one symptom that you're gone in for, and it's not really, taking care of your body systemically. And so it definitely cuts down on ER visits. The next bullet point, better management of chronic health conditions, such as diabetes, obesity, cardiac issues, and hypertension, high blood pressure. So yeah, they can take medications for a lot of these health issues, but we like to take the time to educate on their health conditions and what the individual can be doing for themselves. So like self-care, and possibly even reverse some of those. Pre-diabetes, that's something that's reversible. So again, educating them on what it is that they have going on and what they can be doing for themselves to make themselves better, and maybe not have to take a medicine to improve it, that they can take care of it on their own by doing some self-care. The next bullet point, health promotion education. So I feel as though all the bullet points I've mentioned here, we are talking and educating. So it's definitely an ongoing thing that we do, but it is necessary. As I mentioned here with the doctors and the individual having certain chronic diseases. So like doctors might not take the time to go in depth about what the individual can be doing for themselves. I feel that's where we can actually step in and be able to like help these folks. I guess an example here would be like the doctor will say, oh, well, you should quit smoking and lose some weight. So, the patient leaves the office then and they're like, well, wow, geez, that's great that he said that, but like they have no clue where to start. I feel as though this is where we could step in and guide them in what they need to do and take the time. We know doctors don't have time to be, sitting and discussing every little thing that they have going on in detail. So I feel that they are definitely going to have some improvement with their with this just promotion in health. These last 4 words here on this last bullet point, improved quality of life. There's just no doubt our team approach in wellness coaching, it really truly does save lives. On the next slide, I would just like to move on these next few slides, which are examples of folks that I've had the opportunity to work with. So as Melissa mentioned, the individuals are going to make their own goals, and those goals can change as needed. It could be, we'd like to start them out with very simple goals. Simple goals are more achievable. SMART goals, where they're set to a specific time and that they're accountable for them. But as we, the team, see their needs in their physical health, we're able to coach them in improving their physical health. So like we're going to be aware of what they have going on and, be able to educate them and teach them in the different areas of their wellness. So if their goal is set in one area, we're still going to continue to talk about the other things. They're good reminders, and these examples are going to show you. So here we have a 60-year-old male with hypertension, smoked cigarettes, and they were obese. So their goals over time had to do with the weight loss, reducing that blood pressure, and reducing tobacco use or quitting if possible. So the interventions that we used here was, obviously, we're going to educate him with his health, with his diagnosis, so he understands what they are, the hypertension, and explain how they're actually associated to each other. Smoking cigarettes, that's going to make your blood pressure go up. Being overweight, that again is going to make your blood pressure go up. Nutrition, educating him in ways to avoid fatty foods, things that are going to put on weight, maybe reduce his carbohydrates, sugar intake. We were providing support for him. We gave him sneakers. We gave him the backpack. We were hoping that he would encourage him to walk some more and try and lose some weight. We did continuous wellness coaching with him. This was an individual I did not expect change from. I think he was like one of my first cases. I mean, and this is in the past, so about 5 years ago, 6 years ago. I remember thinking that I don't know if I'm actually getting through to this guy, as I'd be talking to him and educating him in different things. He'd be the type of guy that would, want to change the conversation and talk about what he wanted to talk about. But what I want to say is here, this is a fine example of just the wellness coaching and providing support, continuous. So this went on for about maybe a year. And one day he comes waltzing into the office. He has a huge smile on his face. He's got his sneakers on. He's got his backpack. And he says, "Look at me, Donna." And he had lost about 50 pounds. He had quit smoking. He was eating better, said he's walking to the store, using his backpack to put his things in. So he was definitely a great example of just being consistent with him and not giving up on him either, and just continuing with going on with his goals. If he wanted to change them, we would change them up. Sometimes we'd go back and forth with the smoking goal, but he was able to actually quit smoking by using some vape materials, and getting through that hump of not being addicted to that nicotine. So we give him a lot of credit. He was very thankful for our support that we had given him. So he had a great outcome. Next, we have a 65-year-old female. She's never had a mammogram screening. So her goals were associated in encouraging her appointments and getting, different screenings. The interventions we had used with her was just educating on the reason for screenings, the prevention of disease, or at least, catching diseases early enough so that they're treatable. So getting that through to some folks is really important, because a lot of folks don't want to get screenings. They're like, "Oh, I don't need it." But then, if you really sit and you explain to them, if they get it, they can be treated, because they don't know what things or how life will look like if they have a disease that's not treatable. Like, are they going to want to be sick? Are they going to want to be, home or in a bed? And they don't see the whole picture. So taking the time to educate on that. We've educated her with some self-examinations, letting her know how to do that. We have printouts. We had to help her with interventions in making appointments, encouraging her to make her own appointments, using a calendar. I'm big at printing calendars for folks, writing on them, showing them what to do with it. Assisting this woman in her navigation around her doctor's appointments. So the wellness nurse was able to get involved with collaborating on a lot of her appointments. And the reason being is she had a positive mammogram screening. So life looked a little different for her. A couple other bullet points there: the providing encouragement for her and support. She really needed that. She didn't have a great support system, and we just continuously did some coaching with her. I'd like to say, though, that her outcome with this, even though it was a positive mammogram screening, she did have surgery to have it removed, her cancer. So she had all these appointments. She had hematology, she had oncology, she had to, see immunotherapy, and then see someone for a hormone imbalance. So it was really a lot for someone to take on, especially, again, remembering these folks have their own mental health issues that they're dealing with. She went on to need daily radiation. Just making sure she knew what she needed to do with that she had to go daily, kind of getting her ready for that. So we encouraged her with that, to be ready every day, finding her transportation, which in our area, the American Cancer Society has volunteers that take folks to their appointments if needed, if they don't have a ride. So I want to say that her outcome, it's obviously a good outcome, with such a diagnosis in the beginning, but she was very thankful. She, she has a special place in my heart because she really didn't know how to navigate her way around. And should she not have gone immediately to see the doctors after that screening, that her cancer actually could have grown, it could have spread, and her situation could have been a lot worse. So she again was very thankful, and she had a really positive outcome. Our next example is a 75-year-old male with uncontrolled diabetes and mobility issues. So this interventions needed here with him was to, when I first met him, he actually didn't have a doctor. We need to link him up to a primary care physician. I needed to do some education with him in his nutrition. So he's living in a rooming house. So he has a bed, he's sharing, the bathroom, he doesn't have a stove. So trying to help him with what he should have on hand, things that won't go bad, teaching folks these things. They don't know because it's so easy to run to convenient and just grab something that's not that good for you. Trying to do some teaching back method where we would show him what he needs to do as far as checking his blood sugars and giving himself his insulin, and then he would then demonstrate back to us. Well, this was an issue for him because of his mobility. His fingers weren't, he wasn't able to manipulate the glucose meter, getting the strip into the machine, poking himself to get a drop of blood to check. So therefore, it just led into where his diabetes just was not in control. He was able to actually give himself insulin if he was taking it on time and if he was able to get himself the right dose. So he had a lot of different humps to get over here. We had to link him up to an endocrinologist, made sure that he got a referral after seeing the doctor. And that's something I don't know, if he was, because a lot of general PCPs, they just like to follow folks and treat them for their diabetes. So I encourage folks to see an actual endocrinologist. I feel that they're going to get treated a lot better. And there's new devices out there should folks need ways to be able to check their blood sugar and monitor easily, that they can get these new devices. We, of course, provided support with him and continuous wellness coaching. Like I said, he's kind of a complex case. He had that rooming house. He had bed bugs. His outcome, I want to jump to that now. When he had gone to the primary care doctor, which if you're fortunate to find a doctor that is willing to work with you and is really caring and cares about the folks that we work with, you're really lucky. And we were struck it rich here. So this primary care doctor, he assessed the gentleman. He could clearly see what's going on. He had, bites on him, and he knows that his A1C, his blood sugars have not been regulated. So his first priority was, and he knew where he lived. So again, very complex, but the doctor was able to start paperwork to get guardianship granted for this gentleman, so that somebody can help him with his needs and to help him possibly get out of where he was at. He made it to an endocrinologist. The doctor gave a referral. He was able to get placed on insulins that worked for him for the time being, because then what happened is he was actually placed in a personal care home. So they're able to do his blood sugars every day. They're able to now control his diabetes. He's getting his meals regularly, and his diabetes is under control. So this gentleman, again, this could have been a pretty ugly outcome. He had a lot of things going on. He wasn't living in a great place, and he is one of my elderly folks. So he, of course, he had a great outcome. Things, again, could have turned pretty bad for him. The next one is a 44-year-old female, uncontrolled diabetes and a body mass index, which was above normal. She also had some hypertension. She's a single mom. I suspect she was actually putting herself last when it came to her care. the interventions we used with her, educating on blood sugar numbers and what her A1C should be. So folks with blood sugar, with diabetes, I want to say, we like to provide them with copies of what their numbers should be. Most folks know that a fasting blood sugar could be like between 80 and 100, and that's good. But I'll have folks say to me, "Oh, well, my blood sugar is not. Oh, it's really bad. It's like 200, it's 225," and I'm like, "Well, that's not bad. You know, it depends on what time of day you're checking it. Did you eat? Did you fast? How long ago did you eat?" So the forms that I hand out to folks categorize that for you. Shows you what your numbers should be in the morning fasting, and then throughout the day if you've eaten recently or eaten within the past 3 hours. And then so like people's like their eyes open up, they're like, oh wow, great. So again, educating, something again that the doctors might not take that time to do, I know that. So giving this information to them is very, very helpful. Educating this woman with her nutrition, what she needs to stay away from. Again, not too many carbs. What are carbohydrates, right? Telling folks and educating them what carbohydrates are. Trying to reduce her sugar intake. We encouraged her physical activity, trying to find an activity that she liked to do. And we also reviewed her medication education just because she really needed reminders on that, both with her diabetes medicine and her blood pressure. She actually had a couple stays in the hospital because, everything was out of whack. We provided support for her and continuous wellness coaching. I want to say that so the nurse and the health navigator, everybody was able to work with her, brainstorm ways to remember how to take her medications. She's one that uses a mobile device, so that actually came in handy for her. We showed her how to set up her medications where if she needed to go out of the house that she could just take them with her. We linked her up to something in our area called a food pharmacy. So it's not a medication pharmacy. They actually distribute food. It's a Geisinger provider, and linked her up with nutritionists there. And so her outcome, it's looking really good. She has controlled her diabetes. Through the way she's eating, they are helping her with that. She's taking her blood pressure medications. She's actually walking every day. She found a job that she's walking. She's actually working with the census. So she's walking every day. So this woman had a really good outcome, and just trying to keep her focused on herself, what she needs to do. As her daughter's getting older, she needs to realize that, that her daughter can take care of herself, and mom needs to take care of herself so that she's around for her daughter. On the next example, I have an adolescent activity here. So this was being physical. So we have a school-based behavior health. That's what those initials are. We were getting the adolescents involved in our walks during the summertime. The staff actually works with these folks in the schools during the school year. And then the summertime, obviously they're still working with them, but having something to do was a real plus here. The interventions for these folks was just encouraging them to come every week to our wellness walks. We'd provide them with water. We'd encourage them to take pictures in nature, because we would walk the park and everything looks so pretty in the springtime, and it looks pretty in the fall time with the different colored trees. And during our walks, we would discuss, the obesity, the risks of it, and hopefully that our conversations will carry on to their adulthood. Because, we'd meet in the morning, so we would say, hey, what'd you have for breakfast? No, well, some will say I didn't eat. And so our conversations would lead into, how important it is to eat your breakfast, and even if it's something little. We've provided encouragement for them using certificates. So we would start at a mileage club. So every week we'd walk, we'd log our miles. So then we'd hand out certificates. And our walks actually turned out to have another positive twist on it. So we were walking one day through one of the trails and found rocks that were painted. So in our area, I don't know if all communities do this, but folks will paint rocks, and they're positive rocks. They'll have positive sayings like be kind, love. They'll have pictures. So then that just led them to create their own little activity of painting rocks, and then on our walks that we would bring these rocks and then place them for other people to find. So their outcome with this group was a positive one. I feel that the information we were able to get across to them, they will use that. They will remember what we talked about as far as the eating and getting out to exercise. So positive outcome for the group of adolescents. And just one more example. This is a 53-year-old male, daily tobacco use for 30 years. Let's see, the interventions we used with him, we started out obviously just educating him on the health risks, tobacco use. You know, the nicotine that's in there and all the chemicals. I have a board made up, and it starts out with, you know, the risks of smoking, how it affects our health, you know, what's in the cigarettes, how our brains become addicted. It goes through the whole thing, how it affects the body. We also talk about, you know, replacement therapy. So interventions, maybe using the patch. There are some medications that can help. We encouraged him to attend our smoke cessation group, providing him support, which he did not have, and just continuous wellness coaching for him, because he said he's tried to quit in the past, but he just had no luck. And what I've learned with meeting with folks is that a lot of times they'll try a nicotine replacement therapy and maybe they weren't even using it right. So after talking to folks, you know, just encouraging them to try it again. I'll be here for you, you know, we'll be here for you. Should you have a question, we'll be able to answer it for you. So his outcome, and I saved the smoke cessation for last just because smoke cessation, quit smoking is a very difficult one. This man was successful though. He was able to quit. He was able to pick a quit date. He was able to use the nicotine replacement, and he had no issues. But he was grateful. He was grateful that he had a support person to help him. So great outcome for him, but a very difficult one for folks. You know, I like to encourage them, even if they could reduce, if quitting is just way out of the question. Moving on to the last few slides. As I mentioned earlier, goals are truly endless. They are unique to each individual. And I could talk all day about goals. Those were specific cases, though. Like those were, you know, really specific cases that stand out. But I just want to list here a few goals that are really common. And again, like the folks are going to make small goals. And then, you know, as time goes on, I see that it leads to, if they start out with small goals and then just the discussion they have with the nurse, that they realize, oh, wow, you know, I really do need to get to the dentist. So then they do make it their goal. So it's really interesting to see how things unfold with this. So some goals, just getting an eye exam, right? Getting to the dentist. Some folks have not been to the dentist in years, and I like to just encourage them to go. Our insurance allows us to go every 6 months. So what does that tell you, right? I tell them if they're going to pay for us to go get our teeth cleaned and examined, there's a reason for it. Most insurances don't like to pay for stuff that they're not, you know, don't see a need for. So brushing alone doesn't get everything. You need to get to the dentist every 6 months. Encouraging mammograms. Those are goals people make. Colonoscopies. Actually get them to make that a goal. Just simply drinking more water. I know Melissa mentioned that earlier. Trying to get folks to reduce the soda intake. Eating less carbohydrates. Reduce sugary foods, sugary drinks. There are so many goals. I hope that by explaining these examples, the big examples and these smaller examples, that it's able to just paint a picture for you. So this next, I think it's my last slide. In addition to working with individuals and their specific needs, we also encourage wellness to all the individuals within the agency, not just the folks that are like working in the BHH. So there's this integration of behavioral health and physical health going on. So here's the list of things that we do in the agency. So we do the wellness walks every week. Summertime, we meet at the park. In the wintertime, we walk the mall inside. You know, the wellness walks are good outside, taking pictures, handing out those certificates, making an activity where we were doing the painting of the rocks. We do a smoke cessation group twice a month. Again, educating them from the whole using my board now, the board educating them what's happening with this nicotine, how we're getting addicted, how it's affecting our body. It's going through our bloodstream. It doesn't just affect the lungs. I tell folks, you know, what you breathe goes through your lungs. That goes everywhere. Cancers can pop up anywhere. Wellness topics displayed. We do this in the lobby. An example here would be October is Breast Cancer Awareness Month. So we'll set up information on mammograms, where to get them, how to do self-exams, and different months we'll do different topics. We'll do weights, blood pressures, we'll do the nutrition display, the tobacco education, and then lastly there I have National Wellness Week. 1 week in September, we do the whole week where we set up that each day is targeted on a different health topic. We do informational handouts, we do coloring contests, we do healthy snacks handing out, water, and all the people that participate, they get a little entry for a basket that they could win that. So folks really look forward to that. It's really a nice it's a nice event to hold in our lobby. Well, I hope this information has been helpful and that you can see how behavioral health is designed to improve the health of the people that have these persistent mental health conditions who are also experiencing these concurrent medical problems and wellness challenges. I can say I see the changes and I love being able to be part of their wellness. So thank you for your attendance.